Hi, my name is Jordan Jones, and I'm doing my project today on Saint treatment to help college students with dealing with MDD, which can otherwise be known as major depressive disorder. So, first, we're going to get into what is major depressive disorder. So, according to Neuron 2000, MDD is a medical condition that includes abnormalities of affect and mood, neurovegetative functions such as appetite and sleep disturbances, cognition such as concentration and memory, and behavior as well. So, we're going to break these down further. So, here are the effects of MDD. So, it can lead to a depressed mood or overall loss of interest or pleasure. And again, this leads to a lack of motivation for everyday life and doing everyday tasks, such as even hygiene routines to responsibilities you might have. And next, we're going to get into the neurovegetative functions. This includes changes in sleep, appetite, and energy. So it can either lead to a lack of sleep or an increase in sleep, either of which isn't very healthy just because, as we know, insomnia is something that's really hard because our body needs sleep in order to process and work correctly. And then oversleeping, again, can just lead to a lack of motivation and lack of doing anything productive and taking care of responsibilities that you might have as an adult. This is the same for appetite. It could either lead to a decrease or increase in appetite, neither of which are healthy, and it leads to an overall lack of energy. It also affects cognition and difficulties with attention, memory, and decision making, which again is really hard because it's extremely hard to go through life when struggling with not being able to pay attention or have good memory or decision making, because those are key parts of our day-to-day life and what we need to do as living on this what we need to do while we're living on this earth. Next is behavior, and as you can see through all of these, it leads to reduced functioning in daily life as you have lack of motivation, depressed mood, loss of energy, etc. And the authors also emphasize in the source that MDD is chronic and recurrent and carries risks of serious outcomes such as suicide, which we know is um, a huge side effect often that happens to those dealing with MDD. And obviously, we don't want this happening, and so we need to come up with new ways to kind of treat MDD and actually be successful. So, when it comes to college students, a study done in 2019 found that the first year of college is a high risk period for developing depression. And this is important because it is such a transitional time in students' lives, and the chances of developing depression are extremely high. And according to Science Direct, 1/3 of the college students are estimated to have depression symptoms. And this totally makes sense because, like mentioned, this is a huge transitional period in students' lives as you're thrown into a huge amount of independence that you might not have had before. And you're thrown into a completely new place surrounded by new faces, new people. And this can really cause students to be stressed and develop depression. So here are the typical treatment methods that are used. So we have psychotherapy, and I have some of the forms listed on the screen. And psychotherapy works in order to change thought and behavior patterns contributing to depression. So like CBT focuses on identifying and reframing negative thinking patterns. IPT focuses on relationships, grief, and social changes. BA encourages re-engagement in positive goal-oriented activities, and psychodynamic therapy explores unconscious emotional conflicts and early life experiences. And the thing about psychotherapy is that oftentimes when dealing with those with MDD, it's not all the way effective. It might help alleviate some symptoms, but it's hard for patients to still be able to fully recover with just psychotherapy. So moving on to another form of therapy, we have pharmaceutical therapy, and these are treatment through medications and drugs. So first we have SSRIs, and these ones work to selectively reuptake serotonin. And these are medicines such as Prozac, Zoloft, or Lexapro, and these ones are most common in first-line treatment. The next one is SNRIs, and these ones are norepinephrine reuptake inhibitors. And then next we have atypical antidepressants, which can either help with energizing, concentration and motivation, or sedating, and being useful for those suffering with insomnia and lack of appetite. And then lastly, we have the TCAs and MAOIs. And some people don't respond or see any side effects from medication or therapy, and this is called experiencing treatment-resistant depression. And a lot of those suffering with MDD experience having treatment-resistant depression as well, making it even harder for them to find a way out of it. So recently, a newer treatment method that's come out recently is neuromodulation therapy. And how neuromodulation therapy works is it's non-invasive, and it uses magnetic pulses in order to stimulate the left prefrontal cortex. And this one, RTMS, this one works over a course of 4 to 6 weeks, which is kind of the same amount of time that it takes for um, pharmaceutical therapy and psychotherapy to work. So it has that same time frame, but it's been proven to help to reduce the effects of depression. And now we're going to get into some statistics on those who deal with treatment-resistant depression. So sometimes these methods don't work for people suffering from MDD. One U.S. study estimated that, given in a 12-month period, about 8.9 million adults had medication treated MDD, and 2.8 million of those people had treatment-resistant depression, which shows the amount of people who are suffering with depression with no form of treatment that's actually helping them. So a solution to this is Stanford Accelerated Intelligent Neuromodulation Therapy. And when it comes to treatment for clinical depression, it's important to consider how first-line treatments, like mentioned earlier, psychotherapy and pharmaceuticals, don't evoke any key results in symptom improvement for a couple weeks with those struggling with treatment-resistant depression. And the solution is SAINT, which is what I just said, Stanford Accelerated Intelligent Neuromodulation Therapy. And this form of therapy delivers sessions over just 5 days, and early trials of this have shown rapid symptom relief, often within only a week, which is very, very transformative, because as we saw earlier, all the other treatment methods take from 4 to 6 weeks, and oftentimes aren't found as fully effective for those struggling with TRD, treatment-resistant depression. So this is why this is so revolutionary, as within a week you can already see relief in symptoms with those suffering. So how does it work? So SAINT is an individualized, high-intensity method of transcranial magnetic stimulation, and it involves daily stimulation sessions over a period of 6 weeks, and it maps out each patient's brain through an MRI. And how it works is it picks the best location in the dorsolateral prefrontal cortex to stimulate, and this is the part that's most connected with the region that's most overreactive. So they're basically targeting the part of the brain that's most overreactive when it comes to dealing with depression. And it's very revolutionary because in contrast to the other neuromodulation method that we looked at earlier, which was TMS. This one has a lot more sessions and a lot higher of a dose. So it works faster, and as we see, there's rapid relief within a week. It's non-invasive and it incorporates key amendments, like I said, such as MRI controlled targeting and the higher pulse dose and higher number of sessions. And the results from a study done showed that Saint had a high remission rate, as 90.5 of the participants fit the remission criteria, which is 19 out of 21 of the participants in this study. And the protocol of Stanford Accelerated Intelligent Neuromodulation Therapy was proven to be highly effective while also continuing to be safe. And it produced very high remission rates within a short period of time in comparison to other ways of treatment. And so to close it off, Saint therapy is something really revolutionary that we can really fully develop in order to help those struggling with MDD, because as we see, Saint was able to show significant results within only a week of treatment. And if this is how fast it can show results, imagine how many people's lives can be changed when they no longer have to suffer with MDD due to this. So, this is my works cited, and I hope you enjoyed my presentation on Saint's treatment.